Yes, sir.
Because I'll be seeing my screen, my presentations. I never know whether you are following me or not. If somebody, could answer me, anyone, like, whether you are following up, is there any interrupts, so that we can clarify and we can stop from there, we can do it.
Rishabhan
So
sir,
as
we are able to see your screen very clearly.
Yes, sir. Thank you. So, as we started talking about carbon fiber, so the carbon fiber is a material which is, produced from some organic based pan material. So that polyacrylate material, so which will be, used as a main component, and they'll be doing different process of, making those carbon fiber filaments. To make the carbon fiber filaments, they'll be using different techniques and methods, and like some example like oxidation and graffiting and coating and resin coating, and finally they'll give some tiny rolls, tiny material and small air size fibers. So those fibers will be again used in woven, and they'll be doing some weaving methods, like how we are making this cloth. So exactly like that, they'll be making finally carbon fiber fabric. S- Sorry. So what is carbon fiber? It's a lightweight material and strong composite material, consists of thin crystalline filament of pure carbon. So the pure carbon means we'll be removing all other like hydrogen, oxygen, and everything. Almost like 90% of the carbons will be present in that material, and those things will be used. The reason for the carbon fiber lightweight material is, we are doing all those process. So why? Okay, it is a carbon fiber. It's a lightweight and it has high tensile strength, and it has a corrosion resistance. And why they were using it in medical equipments, and what are all the medical equipments they'll be using it. So that is a main thing and key factor which we need to know where and all we can apply. So right now I'm here to just give an overview about the carbon fiber material, and as a engineering techies, you can decide where and all you can apply those carbon fiber material in your development of your new product or new research or anything else. So the carbon fiber material not only used in the medical equipment, it will be implanted inside the human body. So the carbon fiber can be made as a screws, which will be fixing some fracture of the bones and fracture in the brain, sometimes skull, flap, and sometimes in the screws for a spinal cord. And there are so many applications. This will be used as an implantable material as well. So, but mainly widely as of now used in medical equipment such as imaging tables in the CT machine, imaging table in surgical tables, imaging product like a C-arm, imaging product like any radiation tubes and the detectors areas, wherever they wanted to avoid back scattering of the radiation, wherever they need a high radiolucency. Radiolucency is nothing but like when I expose radiation from X-ray machine or CM or a CT, the material which I'm using, the carbon fiber, it should not scatter my radiation level. It should allow easily pass through the patient body. So that is a thing which we call it as radiolucency. It will be almost 99.9%. It will be invisible during my scanning process. Scanning mean, like as I said, if I'm doing a CT, I'll be doing a patient scanning. If I'm doing a C-arm in the operation theater, I'll be using same carbon fiber material for doing a imaging, like taking a inside the OT, inside the operation theater while doing a surgery. We'll be taking some X-rays used the machine called C-arm. So the machine will be in a C structure. Basically, you would have experienced some X-ray machine. X-ray machine will be different design, and the same X-ray machine will be sometime converted in a C structure where they can easily position based on the body patient like posture in the operation theater, like a supine or a prone or lateral positions that you can do. So, so these are all the main properties of the carbon fiber. The main property for using carbon fiber is radiolucency, and second thing is high tensile strength, and third thing it's also more stronger than almost like 5 times stronger than a steel, and almost two-thirds of lesser weight than a steel again. Like so, this is the main application they'll be using it. And as I said, like medical applications, that patient imaging tables and couch tops and immobilization devices. Immobilization devices is nothing like when you see a cancer patient, when you, if you would have had a chance of visiting cancer treatment room, how they are giving a patient, patient radiations. If you see the patient positioning in the tabletop, so the patient will be positioned in a different angle based on the area of tumor present. So that time to avoid a scatter radiation, as we discussed, so the carbon fiber is a radiolucent material. So the radiation area where we are getting more radiation in medical imaging or medical therapy is cancer department and cancer treatment. So that machine called linear accelerator or cobalt machine or brachytherapy machine, which will emit more radiation, like the cobalt sources are different sources available for treating a therapy for a prostate treatment, or cervical cancers and breast cancers, and there are so many cancers which is under superficial, or where they can do brachytherapy. And for a deep seated tumor, so they'll be using radiation delivery beam delivery equipment that we call it as a cobalt machine or linear accelerators. So these are the two technology which is available for treating all type of cancer machines. So to treat that thing, they'll be having some radiation delivery system, but where we'll be positioning that patient. So that we'll be positioning the some tables. So what the how the table has been made and what are all the things present in the table. So the table will be having like up and down movement, sometime longitudinal sliding for moving patient front and back to wherever I wanted to give a radiations or wherever I wanted to position the C arms. And with that, we'll be using some hydraulic or motorized actuator to do up and down and sliding and tilting of the table and do this. And once you construct the table, and what will be the tabletop material? So earlier stages when CM, that X-ray was produced, so they were trying to find out what is invisible under X-ray machine. So that is the time they experience so many material like steel, aluminum, and titanium. There are so many material they tried, and every material had their advantage and disadvantages. Like steel, it never allows you to do imaging, and even again aluminum has partially invisible, or it allows radiation to pass through. And then they finally found out wood is a material. Wood, the simple wood is a material which will allow you to do a imaging and with a scattered radiation. So that is how they started doing a intraoperative imaging or normal imaging with a wood kind of material, or we call it as some ilam sheet or phenyl sheet, which is nothing but compressed tissue paper kind of material, which will be compressed depends on your weight bearing of the patient. So if you are using a patient which is more than two patient weight 100 kgs, so you obviously need to have a bigger thickness. So what happens if I use a bigger thickness wood or ilam or phenyl sheet? What will happen? So it will increase the thickness of the sheet at the tabletop. Again, it will give a more scatter radiations. So what will happen then to get a better image of my femur or my abdomen or my knee? Again, I need to increase my power of my machines, like producing, we need to increase power in my generator in the CM or, X-ray machine. So what will happen once I increase? So it produce more radiation for that thing. So it will hit that top, that wood top, and it will go to the patient body. It will give. So what is the main disadvantage using this wood? So it will give you more scatter radiation. So you need to generate more radiation than the required one. So what will happen to the patient? Patient unnecessarily getting more radiations. And the working professionals, because patient is the one who's coming for that single surgery or single imaging. You just think about the working professional who's doing x-ray technician or a CT technician and x-ray machine handling people every day. They'll be doing nowadays 50, 60, 100, depends on the workload in the hospitals or clinics. They'll be doing 100 x-rays. You just imagine if we use the same wood material which was used almost like a deep more than 50, 60 years ago. So you just imagine how many working professional will get more radiation. And if you are getting more radiation, what will happen? And did anybody know if you are getting a more radiation, what will happen to the human body? So this is not like, testing your knowledge. Even the information which I'm giving, maybe some errors will be there and you have to, just pardon me, and sometime you can ping me personally. You can tell, Sir Vijay, the thing which you have said, it's not that 100% true. Yes, obviously we can see what is correct, and so that in that way we can evaluate ourselves and we can learn more. So I'm not trying to test you, because I just wanted to follow you. I just wanted to be with you during the session. Did anybody can answer, like, when I give a more radiation to the patient, or when I generate more radiation to that environment, what will happen? Did anybody visited any hospitals, or did you ever personally gone and done some X-rays of chest, or CT, or even normal surgical thing which has been done? Anybody got operated? Anybody has any information you can share to me, so that we can go from this session, we can go forward. Or else I can tell you, like, it's not testing your knowledge. You can answer anything which you feel which is right, or which you feel this may be.
Maybe internal organ damage,
Okay, anyone?
Even it can
cancer.
cause uh, risk
Cancer cells development,
long
sir.
Okay, good.
and also may cause fertility issues also if it's a lady.
Okay, good.
Sometimes vomiting sensation, hair loss,
Mm,
so the skin damages will happen.
nice.
The cell
Yeah,
integrity gets damaged.
yeah. So basically, this all the answer given is right and depends on the radiation level which the patient or which the person has gone. So basically what will happen, like, it's like radiation is, we never seeing, which is already there, presence near you and above or top anywhere, because everywhere there will be some radiation. If you have some detecting radiation detecting devices, you just go to some beach areas of Kerala, it will show more higher radiation than any other diagnostic center area, because that coastal region already tested where more radiations presence naturally. So this is this when I went for a AERB, Atomic Energy Regulatory Board, for my servicing course. So they explained there are some places where natural activity, radiation activity is present. So that naturally the radiation has been emitted different places and different time. But here, what we are doing, we are generating a radiation using X-ray tubes and the detectors, and doing this. So as you said, it will what basically that over radiation, too much of radiation, or unnecessary radiation will do to the humans is, it just do a chromosomal aberrations. So what happened? It just breaks that DNAs. So while you are breaking it, it will be doing so many irregularities in your human bodies, as you said, like organ damage, or infertilities, or skin cancers, or sometimes you'll get like a wound kind of thing. Sometimes you lose your hair. Sometimes you lose so many things. Like, so basically, that radiation will harm you if it is too much. So how to reduce that radiation level in the examination, or even therapeutic time, to get safer radiation for imaging, because obviously we need a radiation to imaging my bones, imaging my brain, imaging my guts, imaging my chest, find out what is that broken bone, where it is broken. So we cannot avoid the radiation to do a imaging, and we cannot avoid a higher level radiation to treat the cancer patient, because if you see cancer machines, cancer patient, what we are doing, what we are delivering to the cancer patient, as everyone said, we are damaging some portion of tissues inside the tumor. The tumor is malignant. The tumor is cancerous. So what we are doing, we are targeting certain region. If, for an example, if some patient has a breast cancer, so earlier days they used to do a mastectomy. So mastectomy is nothing. They'll just remove that breast of the cancer patient, and they'll do full removal of like the breast. So the technology improves. Nowadays, mastectomy is almost like 90% has reduced, and we are going for radiation delivery, radiation beam delivery to do a breast cancer patient, even for a prostate. The reason is, we are giving a precise, targeted treatment delivery for that. Somebody's mic is unmute, and hello, there are more than
I think someone is unmuting their mic.
hello, guys. Thank you. Yeah. So, brother, hello.
I think now it's
It is
okay.
Mr. Rahul. I think now he has unmuted, sir.
Yeah, somebody is muting my. No,
Now,
this is me, madam. Can you unmute me? I'm not making noise.
okay, okay.
This is VA is me, Vijay Kumar. So don't unmute me. If you want to stop, I'll stop. So
No.
yeah, yeah,
You want to continue.
yeah. Thank you. So where I was in the noise. Okay. So uh, while to deliver a precise, targeted high energy radiation is also.
Yes, sir. Okay, you can continue.
Yeah. So this radiations also can be controlled, and we can give a targeted therapies for cancer patients. So this and all possible, and this is there, and that machines will cost you from crores to even 500 crores. Machines are available, but to do all those things, to do a patient lie down, you need a tabletop, and the tabletop should give very lesser attenuation or even zero attenuation of backscatter or scatter radiation to the patient or the environment. Maybe in the operation theater, maybe in the treatment room, maybe in the imaging areas like a CT room or X-ray rooms. So for that, and this is the place where we are introducing a carbon fiber. So the carbon fiber, as we discuss, as we seen in that applications, we'll be using imaging devices and operation theaters and these areas. So while I'm doing this, if I'm giving a 50 like MA of radiation to the patient, or generating some 50 MA of delivery to the patients for imaging for a normal wood base, that earlier base top. Now you can give at least 30 or 35 MA to get the same imaging. So what that carbon fiber material is doing is, so it will give you lesser backscatter. So it allows you to deliver precise and without backscattering any, without stopping. So let me tell you in a layman word. So what happened when I'm doing a exposure of that imaging for as X-ray or a CT or anything, if I use a wood, what happened, I need to use a 50% of my radiation. So if I, the same time, if I remove this wood tabletop, if I put a carbon fiber material tabletop, what happens? This fill almost drastically 15 to 20% of radiation can be reduced, and you can get the same imaging. See what happens. So my patients or even the technician who's generating radiations, who's delivering that radiation, is getting lesser radiation. And second thing, you never have a scatter radiation. So when I'm doing a chest X-ray, it should go to my chest. When I do a pelvis, it should go to my pelvis. It should not scatter and it should not go back to some other humans who's around it during my surgical procedure or during my imaging procedures. So that is where the carbon fiber is mainly playing vital role in medical imaging overall, either maybe inside the operation theater, either maybe in the imaging room, or in even the CT machines. So this is the place where they'll be using all these carbon fiber tabletops. And as I said,
Vijay
in the
sir,
cancer,
sorry
yes,
to
yes.
interrupt. Are you presentation?
What's that?
Are you showing your presentation?
You want to? No, no, no. I'm not showing anything. I'm just talking.
No, no, no. Just so okay, okay. Just I'm asking.
Yeah, yeah, yeah.
Okay.
So if you want, I can show you what is this carbon fiber tabletop, because many of you would have seen, many of you would have not seen. So this is like we integrate making a carbon fiber. Are you able to see my presentations?
Yeah, yes, sir.
Yes, yes.
Yeah. So the red color marked one, the black color stuff which you are seeing is a carbon fiber material. So that flat one, the first one image from the left side, your left side is a flat tabletop, which will be where the patient will be lying down, and they'll be doing a imaging. So top of it, they'll use some foams for better uh, avoid skin pressures related issues. So they'll be using it. And second thing which are doing, which we made for some cervical based, cervical spine, your neck area based surgeries where they'll be using. And third one which are showing is horseshoe headdress, which is fully made up of carbon fiber, the red color marked one, if you see. So this is like actually I've used the horseshoe which I made. What I did, like, while I'm making a carbon fiber tabletops, the flat one or the second one image, so we'll be wasting so much of carbon fiber fabrics while I wanted to make some shapes, we'll be cutting some fabrics based on the shapes. What happened? That waste material will go into that garbage. So what I did, what I decided, why I need to throw, because basically that why the carbon fiber, is not spoken lot in India or spoken lot in our biomedical community is, first of all, in our biomedical engineering stream, we never talk about this kind of small nuance where, we never think which is more important. As of now, the introduction, the thing which we have discussed, if you see, you may have a better CT machine from GE, Philips, or any companies. You may have a better MRI machine from any big companies. But finally, if you don't have a carbon fiber based top, you can't do imaging. You can lie down the patient. So which we miss out always. We, as I said, why I introduced myself, I started selling ECG ventilator. This is a thing which we every day we come across. We talk about this ECG defibrillator ventilator. Sometimes now we are talking about AI based softwares and so many things. There are so many small uh, medical product which, as a biomedical engineers, as a medical engineers, as an industry guys, we never talk about, we never get interested. So that is where myself and Bhupati wanted to create some awareness. So we quite often discuss about different concepts of doing and helping our patients. So because the 300, 350 people who presents, we're all getting experience of visiting hospitals every day. Maybe our children's, maybe our parents, maybe our brothers. We are all visiting hospital. We are all seeing as a medical guy, medical engineers, medical techies. But what happens? So like how we are seeing that hospitals, how we are focusing. But if me or Bhupati and we visit hospital, we always look, instead of going for a treatment, we always look why they are using this, why they are not using this. They can do like this, because we always should apply, because that is how we can grow our knowledge. That is how we can create something which is most useful, most viable solution. Because I can proudly say, before me and after me in India, the carbon fiber thing, which is now like almost like 5 years we completed, drastically improved. among the surgeons, among the spine surgeons, neurosurgeons. The reason is the big great companies, they come and they'll sell, they'll go. Because this carbon fiber is made by only few companies in the world. Why? Because the main thing is cost. Second thing is, it's not much available and not much used. The reason is this. Because they wanted to buy a table, surgical table or imaging table. Even when you want to buy CT machine or X-ray machine, we always talk about what is a MA, what is a generated power, or what will be the quality of imaging and everything. We never talk about what is in the table, how it is, and what is the advantage while I'm going for this carbon fiber based or high energy based treatment. So what will happen? So this we need to create, and there are so many opportunities in the carbon fiber segment. You can create lots and lots of medical products. I'm just giving you the small 0.1% of insights about the carbon fiber. But if you dig into that, you can create so many. Even if you're not willing to create a carbon fiber in the medical, you can create so many things. There are vast applications, but you need to create awareness. So this is the three products which I've shown you. Last one, Arshu addressed, which is purely developed the waste material, that cutted waste material. I just keep it safely. And again, I'll take some, I'll make it in a small pieces. I'll do forging. Forging is nothing but, I'll just mix some couple of, chemicals like resins. I'll create a mold, dyes. Then depends on, that application. So what I'll do, I'll just compress it. I'll leave it. Once it is cured, once it is ready, I'll take some machining work, finishing work. Then this will be ready. The advantage of this Arshu addressed, when any brain surgery is happening, when any spine surgery in the neck is happening. Normally, if you go to any hospital, you just, when you experience, when you visit, when you get a chance to visit hospital, when you get a chance to talk to biomedical in near future, or the surgeons, if you get a chance to the surgeon who's doing a spine surgery or neurosurgery. So how are you imaging inside the operation theater? What is the resting of, what is the head resting material or, device or, equipment you are using, sir? As an engineer, as a technology guy, as a research scholar, I just wanted to know. You just started ask about this, and they almost, I can confidently tell you, 70% of the surgeon never knows. 95% of the biomedical never knows what they are using. But if you work in a company, and if you wanted to work in a company, if you see, but they are the people who deciding of buying those equipments. So what we are doing is, we are basically started emphasizing about the carbon fiber in the medical products and medical imagings, and sometimes implants. So we are emphasizing the advantage of carbon fiber products over using some traditional method of doing surgeries. So in that way, your surgery will be very faster. In that way, your accuracy will be more. In that way, your imaging will be pakka inside the OR. So what will happen? Basically, any screw or any plating, so they will do a operation. They'll do some nominal check whether I place my screws or not correctly. Then they'll send the patient to ICU. After that, the patient will go to home. After 3 4 months, the patient will come with the same or different pain or problem, saying that, doctor, I have a pain in that operated area. So what would have happened? That screw would have gone in a different angle or different length they would have used. The reason they would have not used this kind of imaging a tabletop or imaging Arshu addressed or imaging positioning devices, where again the patient should go for revision surgery or one more surgeries. You just imagine doing one surgery itself, it's a very nightmare. If the person is going for a one more surgery for medical negligence, or it's not properly seen during your screw placement or during a surgery, it is the biggest problem, and we never talk about it, and we never know why it has happened, because you cannot do cross checking, because you are already dying in the pain, so you cannot do that. But as a engineers, as a technology, as a solution provider, we need to think why it should happen. Why can't we do like this? So this third image which you are showing, that which is made in that waste material. Only my time, my another my dye investment is there. But again, I am making this waste carbon fiber material into my product. I'm making business out of it. So like that, as an engineer, we need to think. So how I am going to do my product development or my research in the carbon fiber. So here you can see what I'm doing is, so he is the surgeon who's doing a spine surgery, where spine surgeon, where when they wanted to open some vertebrae, to remove some disc or, to do the surgery, they wanted to create some curvature because once you lie down in the operation theater, you cannot simply move the patient from bending or flexion of doing extension of the patient. So for that you need some flexible and bendable product. So that is called bow frame, we call it as, or a Wilson frame we call, and we developed that too. And this is the thing which we developed and we shown to surgeon. He got impressed and he liked it. He wanted to test himself because the surgeon never seen that carbon fiber material, such a lightweight and such a glossy. If you see this left side one, which is like brittle kind of material. Obviously, anybody who never knows about carbon fiber properties, they'll think, no, 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 this will break, 100% will break. Because again, it's bending also. So the last image which I've shown you, that is more stiffer one. But here, what I'm doing, I'm making a flexible carbon fiber. So as I said, the carbon fiber is more stiffer. If we use different fabric and different method of making a flexible making a method, you can make a flexible carbon fiber for these kind of applications, where you can do flexion and extension of your spine, and you can do a better vertebra or a spine opening, and surgeon can easily remove that damage or like damages disc, and you can do it as soon as possible without damaging any other parts in the spinal cord or vertebrae or pedicle areas, so that you can do it. And here you can see the waste material in the horseshoe which I talked about. So they are positioning that in their head, and here they'll be doing that neck area, that cervical spine area surgery. So now you can see that this is the right side which you are seeing is a C arm. So they'll be doing like this. Now, if you see that C arm, that C structured one on the right side, if you see the left one, the black color thing, if you see from head to chest, there is no metal. Everything is carbon fiber. So depends on surgeon required imaging angle. He can rotate his imaging device called C arm. He can precisely position. He can precisely see that area where he wanted to screw in the cervical spine area. You can see, you can screw, you can go the depth, you can see the angulation of the screws. I can perfectly place the screws and you can come back. You can extubate the patient from that machine. I can send the patient to ICU and he never come back for any complaint about his surgery, because the surgeon is able to see everything inside the operation theater itself. We no need to even go for a post-op imaging. We call it a post-surgery imaging. What we do basically, we even still 85% of the hospital, they don't have this kind of setups. And what they do a surgery, they do one more CT imaging, and they'll find out everything is perfect or not. But if you use this kind of carbon fiber products inside the roti, you don't need to do that. So in that way, first and primarily, you are saving a patient's life. Second, you are saving your time. Third, you are not doing one more revision surgery, or you are not being a failed surgeon or a failed surgery. And finally, the patient burden for one more surgery is reduced, and almost like it's a life-saving thing which is easily doable just using a carbon fiber products from the waste material, where basically they will throw. I'm using that waste material into the product. Then we are using this and we are helping the patient. We are saving lots and lots of money, and primarily we are saving a patient's life. So this is the one more product which we are doing. These are the surgery has been done for doing spinal cord surgeries, and these are the different applications. So example, nowadays we are talking about stroke and heart attack. So every day, some people, some part of India, some part of world, even young people are getting heart attacks. Young people are getting strokes. So the reason we don't know, but we can't prevent that stroke or heart attack, but we can image those stroke patient or heart attack patients clearly while producing this carbon fiber based arm race, adduction scoop, or neuroimaging head extensions for existing hospitals or new hospitals. So these are all the development which we did and which we have been happily and proudly supplying to many hospitals across India and across. So we are doing it. So these are all the products which we developed and we'll be doing it. So the challenges. So what will be the challenges? The thing which I'm talking maybe seriously or sometimes maybe interesting and you may think it's good, but challenge of making this product, it's not easy, like making some metal based work or making some computer based softwares, because to make this carbon fiber thing you need to have a cutting, like basically it's like carpentry work. Basically it's a carpentry work, because what you have seen is thing, you need to cut the fabric, you need to do the molding, you need to create a die, you need to again finish the product, you need to cut, you need to use a saw, you need to use a drill, you need to use a buffing machine. So if you see, like basically if you see as a manufacturing side, it's a carpentry work as a layman word. But the challenge of this main carbon fiber making is cost of the carbon fiber, the composite material, because 1 square meter in India, which will cost you almost like 3,000 rupees. To make that one carbon fiber extension for intraoperative imaging, it will give you 3 to 4 lakh rupees. 3 to 4 lakh rupees for 4 feet length and 2 feet wider tabletop is almost like 4 lakh rupees for making and manpower and this thing. You leave about cost. And second thing, there is a health hazard who's working in the carbon fiber. So it's not easy to work with the carbon fiber, because while you are cutting as we discussed, the carbon fiber is invisible in X-rays. Sometime if anything goes inside my lungs while I'm cutting it, while I'm machining it. So even if you do a CT, even if you do a MR, it will not visible what is happening inside your lungs or inside you are anywhere. It's went inside your human body. So you have to be more protective. So you need to use all PPE kit, protective equipments like eyeglasses and the PPE kits and head helmet, the proper shoes and everything. Just imagine every day if you are going with this kind of making, it is not easy to work with the carbon fiber, because as a laborer, as a technician, as an engineer, if you are cutting a carbon fiber, it is not easy like cutting a metal, or it is not easy like cutting a wood. It is entirely dangerous, and it has to be accessed, carefully handled. So this is the main challenge. And again, like obviously to make all the other regulatory works, obviously it will be there for every product. Again, this carbon fiber, again, it has few more extra mileage, adults, because we are, as I said, we'll be implanting inside the human body. So while we are inserting some screws or plating inside the human body, that biocompatibility should be there. The chemical, the resins which are using, binding those carbon fibers and making the screws, it should be biocompatibility and it should not react with human tissues. So these are all the regulatory hurdles will be there yet, but it is doable. There are people are doing it. So before I go for a conclusion, let me show you some. Bhupati, do we have a time? We have a time, right? Now it's 5:40.
Yes,
Up to
yes,
6 or 6:30. Up to 6 or 6:30.
6:30 we have time.
Yeah, thank you.
So maybe after
And
6:15 they can ask you questions. Maybe like
yeah,
you can
yeah,
interact.
yeah. Yeah. So let me tell you, this is the one company from Israel. They'll be making all carbon fiber implants. So implants, which I talk about spine, ortho, and everything. If you would have seen some spine X-rays, spinal cord X-rays, you know what I'm showing it. Did everybody able to see my screen?
Yes, yes.
Yes,
Yeah.
yes.
So here you can see this is the one patient spinal cord. So the screws you can see one, two, and three screws. So each side, both the side they'll do screwing. One vertebra is nothing but if you see the screw, so the screw placed area it's a vertebra. So one vertebra like that we have different vertebra. We call it as cervical spine. We call it as thoracic spine. We call it as lumbar spine. So that the spine has been divided into three segment. So the upper portion is the neck area will be cervical and the chest to lower body will be thoracic and low the hip regions will be that lumbar areas. The lumbar to pelvis areas will be lumbar spine. Lumbar spine. So here you can see that screws and again like that the top of the screw there will be some bend material which is used. These are carbon fiber material based, but it's not purely carbon fiber. The reason is you need to have
So, dear team, please wait. So, I think it's disconnected from this side. We'll check.
Sir, I think we are not able to hear or see the lecture.
hello
Just
now.
yes, sir. Yes, sir.
It no, it's got disconnected. Now you are able to see.
Yes, 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 sir. Yes, sir. It's correct.
Yes, sir.
Sorry, suddenly got
Yes, sir.
disconnected.
Yes, sir.
Yeah, yeah. Now you are able to see my screen.
Yes, sir. Yes, sir.
So this is a spinal cord implant product which is made up of carbon fiber, but they'll be using a different composition of material which they never disclose for a proprietary thing because they wanted to do their business. But it is easily doable in India as well. But for that you need to have a different kind of material and different kind of research team. For that you need to have a basically commercially viable and commercially available to do all this research and development thing. If somebody is interested and you can go ahead, you can do it if you have a better financial support from your end, and we can help you out to put it in the right place and the right people where you can develop those products if you're really interested. So this is the Carbo Fix is a company who's primarily developing those items. This is not only for a spinal cord. And as I said, whatever this company, you just go and type Carbo Fix, in the Google search. Whatever I told you and whatever we talked about now, that easily and highlighted in the bullet points. So what is the advantage of carbon fiber using why carbon fiber? They'll give you nice insights about it. If you read it, you'll get to know about it. Why they are using it in radiation therapy, and that will be to shown you. It's perfect. Yeah, here you can see. I'm talking about scattering, backscattering, backscattering. Here you can see that graphical representation. If you use a metal or different material than a carbon fiber, you see it's hitting that implant and backscattering. And the same time, if you see the right side, the graphical one, it's a carbon fiber based implant. It's not, backscattering. You can see it's going and hitting the targeted tumor. So this is the main advantage. Beautifully, they shown you. So what is a backscattering? It's very simple. So this is the thing which while you are using a carbon fiber one in the radiation therapies and as well biomechanics. So why carbon fiber used and what is the advantage and then a metal and this thing here you can see how they are testing this carbon fiber, and this is how they'll test each screws and each rods to do all these implants and biocompatibility, and they'll do this static test and in the lab and they'll be producing those items. And just for your commercial knowledge, the screws which are seeing, that four screws, one screw will cost you almost like 1.5 to 2 lakh rupees. So if the person has to go for a two vertebra joints or a two vertebra spinal cord surgery, just imagine the four screw alone will cost you. And the rod is different. Again, it will cost you 1 lakh rupees, different length. So you just imagine, like, potential, commercially potential marketability and, advantage, and the commerciality advantages in this carbon fiber segment. You can do it. But again, like, as I said, it is not, as like I said, it is easily doable, but it is doable. Depends on your commercial advantage and your interest and the area which you are choosing. Because even I can make this, but to make this, as I said, regulatory and the machining, and that investment will go in a different level, which even no Indian company is making it. So that's what. If we are commercially available, anybody who's really interested, they can make such as so many products. Not only this, I can show you there are so many products they'll be making, which is so fascinating and interesting to see. Because you just imagine, once you somebody got broken leg or broken hand, broken hip, this carbon fiber weight is almost like 5 times lighter. So you are giving some lighter weight thing. And second thing, while if you are going for some other medical complication, if you have to do some MRI, if you use a metal screws or metal insert, you cannot do MRI imagings. So that is again nightmare. So if you use such kind of carbon fiber implants, there is no restriction. It is like almost like 95% like normal bone, normal tissues. So this is the X-ray visualization of spinal and vertebral things, and they'll be making so many products, and they'll be doing it. And I can show you certain images for so how this carbon fiber in the real world, India, how we are helping them to do those surgeries. And yeah, so here you can see they are doing a CT imaging of the brain patient. So the blue color material on the bottom, the table, the black color one, everything is a carbon fiber material, or the translucent material. So this is for doing DBS cases. DBS, like if somebody patient's having what is it, Parkinson's syndrome, they'll place some um, needles or electrodes inside the tumor where it is affecting, and they'll be simulating some thing to uh, treat the patient. So this is what they are doing it. So in the CT machine they'll be using it, and I can show you doing a hand surgery you can use it, and doing spinal surgery, and I shown you the cervical based surgeries, and I can show you. Yeah, this is like yeah, this is a thing where different angle and different screws, and surgeon easily inside the operation theater itself, now you can see. So you just imagine, if he is not having this carbon fiber material, if the screws goes little extra further inside, so it will come out of my spinal cord at the vertebra. And if it is going in a different angle, it will just hit my nerve root, my canal. Then the patient will go paralyzed. Anything can happen. So that is avoidable if you use a radiolucent material inside the OT, inside that imaging thing. And this is how the patient will be positioned for a back, like hip lower spine surgery. You can see the patient is lying down with our imported product. The black color thing which you are seeing in the abdomen area throughout the length, which is the carbon fiber tube, very, very small, but it can weight bearing will be more than 300 kgs. So you can load the patient up to 300 kg. Now you can have a 360-degree of imaging. Whatever the surgeon is planning, he can do, he can see, he can execute, he can send the patient safely to his, back to his normal life, that he can do. So There's a thing, and sometime I can show you some videos for your knowledge. Yeah. So, so this is the imported one from UK, which we are selling it in India. So here you can see they have different components. So the black color, the textured one which you are seeing, everything is a carbon fiber red lucent material. Top of the blue color cushion, it is a red lucent materials. So, so if you ask me like how many hospitals are using this kind of setup to do a better surgery, if we ask in Coimbatore alone, there is a one or two hospitals, maybe three, maybe Ganga or KMCH or Royal Care. What about others? Whether are they not doing any spine surgery, or they are not doing any trauma? Yes, they are doing it. Then how they are doing it? So they are compromising on that imaging of patient and doing those stuffs. So that is what, as I said, we are trying to educate the patient and educate the hospitals to save their money and save the patient's money and do the surgery in a faster way and better way to avoid failures in the surgeries. So now that industry is changing and the technology is changing and people are started, accepting yes, which is important, then making a big profit because this is a dead investment. Because as an engineer, let me tell you in that way. Because if they buy these items, as I said, 4 feet to 2 feet tabletop, they need to invest 4 to 5 lakh rupees. What they'll get in a return, they'll get nothing. But if you buy one ECG machine for 1 lakh rupees, but he will ask you to pay for one ECG 1,000 rupees. So he will recover his money doing a ECG, doing a laboratory test, doing a CT scan. But whereas in the surgery, they can't charge like that. So that is the main thing why they're not afford to buy this. Because why I need to do all this? If the patient's the surgery is getting fail, okay, let them come back. Again, I'll do one more surgeries. Or else they'll think, okay, I know I am a better surgeon. I'll do it in my own way. That will never fail. But we cannot tell whether it will fail or not. Because invisibly you cannot put the screws inside the body. So that is the thing. So this is a product which we are doing it like that. There are so many products which we have been doing, and let me show you how that Siam will take a image or this thing. So I'm saying different angle, different length. You can see that Siam is moving from 90 to almost like 180 degree, 200 degree. So different angles, the Siam will move at the time your table, that carbon fiber material will give you easy access of doing imaging. So I can take a 360-degree imaging inside the operation theater. So I know all the angulation, all the three axes I can able to see. So that my treatment will never fail. My surgery will never fail except any other unfortunate evil. But a person confidently, the surgeon will go out or send the patient out, whatever it is right. If we have this kind of setups. And that is a C-arm. This is, we call it as a O-arm. So this will give you a 3D view of your anatomy. So it will take a same X-ray with higher level of radiations. It will give you three-dimensional views. Do scanning. So it will like open, then it will go inside, then it will close, it will take a X-ray image and it will show in the monitor. So this is, we call it as WAM. There is one more imaging device to do a surgery inside the operation theater, that is called intraoperative CT. That there are two companies in the world which they are making. One is Samsung Medicine, which is India, known by Schiller as a company who's promoting and selling it. And second one is this from a Brain Lab. This is called mobile robot, imaging robot. Here you can see whatever you're seeing in the graphical representation, it is coming automatically. You can use this tab, you can operate. It will move, it will come there, and you can mark that spinal area. It will take a spin and it will show you your anatomical structure of your spine. Then you can start doing your imaging. So if you see, to do use this intraoperative CT or OAM or CAM, the patient is lying on our carbon fiber product, carbon fiber material. Without that, you cannot take all these 3D imagings. The future is going to be every hospital, maybe in another 5 years or 10 years, everybody is going to have this kind of setup where they can inside the hospital itself, they'll be doing a better surgeries. So no more no multiple days hospitalization. They'll do small, minimal invasive surgeries like keyhole surgeries. Yeah, getting to know about this brain lab product or OAM, Medtronic or some other 3D modality machines. For that, the greatly that carbon fiber is helping to do better imagings. These are all the main and sophisticated and beautiful imaging product which has been developed to support the hospitals So for that, we started doing this researches and started collaborating with the doctors, getting to know about what they need, and we are trying to do something. We are in the initial phase. Maybe like we may be 1% we started doing this, but we alone, Integrate alone can't do it. So what our aim is to educate more and tell this importance of intraoperative imaging or medical imaging and radiation level and radiation level, especially for a pediatric patient, because pediatric patients are most vulnerable than adult for a radiation. So to avoid those radiation for a pediatric patient, it will be great useful, because nowadays there are so many pediatric patients are going, maybe because of the accident, because of the gene issues. So for them also we need to consider that will be helping more pediatric patients also. So the carbon fiber will give you more advantages than doing this. So some of the hospital, how we do a demo is like, you can see that I'm standing top of this carbon fiber, because as I said, if you see that carbon fiber top, it's like a glossy glass material. If you see what happened, no, I don't believe this is 4 feet length. Sometime it will break, because they never had a chance of utilizing or using this product. After we do like this, yeah, it's perfect, because the 90 kg or 85 kg guy is standing on the edge of the top. Still, it is not bending, it is not breaking. It's perfect. So these are we will be doing demonstrations. These are we'll be doing surgical thing. Here you can see that same top which I was standing. Now the patient has been imagined. This is in Coimbatore. This is in Bangalore. On one of the hospital, they bought this machine, so they are using this technology with our carbon fiber top. So they are doing a 360-degree imaging inside the operation theaters. Here you can see. So they put a patient. The patient is fully on the cantilever positions. They can do here. So these are all the tests we do before we go and use the patient for a table, because we need to consider. Yes, I can give a better table top, the carbon fiber one, stronger one. But what about the table which the customer is using existingly? Whether that is strong enough to hold the patient in the cantilever. So like that, there are so many things and so many products which you can make in the carbon fiber. It depends on us which modality and which field, based on our interest and the capacity we can choose. And it's a ocean actually. This is the company which developed robo-based carbon fiber table. You can see I'm talking about flexion, extension of spine. This robo will do everything. So if you see, if I wanted to flexion, so what I've shown you is, some small bow frame or Wilson frame I developed, because not everyone can afford to buy this 5 crore rupees robo machine. This is from Japan. So this is a robo table, which is used primarily, mainly for spine surgeries. Here you can see. As I said, 95% of the hospitals in India, they are not afford to buy this 5 lakhs. Who's going to afford to buy this 5 crore rupees machine? So we need to have a different segment of radiolution product. I'm not saying 5 crore they'll not afford, but there are hospital they can afford 5 lakhs. There are hospital they can afford 50. There are hospital they can afford 5 crores. So it depends. There is a different segment of clinics and hospital, because not every city is going to buy, because Chennai is different, Coimbatore is different, Pollachi is different. So if you talk about, you need to create a affordable solution for each segment customers. So that is where in here in India we can play vital role, and we can develop more, and There are lots of scope in a carbon fiber alone. So don't think that I wanted to develop, a beautiful AI-based software for doing a brain mapping, brain imaging, or doing a robot and or ECG or a wireless ECG or wireless BP monitor or wireless, BP cup. Yes, it is necessity, but this is the thing which is untapped or untouched and unspoken. The carbon fiber products, carbon fiber material in the medical imaging and medical industry, which is widely and easily accessible, easily usable. So it's up to us to decide whether I need to go with this or that. So that's it, guys. And finally, I'll show you only one video. So how this stiff carbon fiber can be bendable. Here you can see that person abdomen is going up while I'm cranking that crank. You just see that carbon fiber strip, which is in the abdomen area, the body, it is flexing. It'll never break. So it create arch. So the table, that 5 crore table which I've shown you, that Coimbatore, even Ganga or KMCH will not afford, but they can buy this. The same function, same positioning, same flexion. Because here I'm doing the same flexion of my spine. This also, I'm doing the same flexion of my spine. So if I give a solution for 3 to 4 lakhs, why people wanted to have that 5 crore rupees? So it depends. So we need to see who's my customers. So who I am, which segment I'm focusing, which area I wanted to do a business. I wanted to, so simply if we talk about layman talk, like not everyone is afford to buy a Rolls Royce, not everyone is afford to buy a car also. So we need to design and develop and which product and which category of people I'm choosing, which category of hospital I'm trying to do. But everything is needed because this table, this 5 crore table has so many advantages than the 3 lakh, 4 lakh rupees product. We cannot say which is not required. But what is mainly and basically required in the operation theater for doing the surgery, which we need to more concentrate to do a better patient's surgeries and patient safety. Thank you. Any doubts, anything, you can directly contact or you can send me an email or WhatsApp me. You can get my detail. And first of all, thank you very much for giving this opportunity, Bhupati and Prashant Medical Technologies. And
Yeah, so
thank you
thank you
for
so
Sir,
all
much.
the
can you
participants.
share your mobile number and email ID, sir?
Yes, sir, you can get it from that Prashant Medical Technologies